Microwave ablation of the liver tumors is done under image guidance, commonly under CT guidance. It is most often performed by a specially trained interventional radiologist on an outpatient basis. The patient lies on the procedure table. The initial CT scan is done. The location of the lesion is determined and entry site is marked on the skin. Then, the access site is sterilized. The skin and liver capsule are numbed with a local anesthetic at the access site. The access area is covered. A very small nick may be made in your skin to make it easier to pass the needle into your liver. Then the microwave ablation antenna is placed under CT guidance. The radiofrequency energy is then applied. Each ablation takes about 10 to 30 minutes, with additional time is required if multiple ablations are performed for larger tumors. At the end of the procedure, the needle is removed and pressure is applied to stop any bleeding. Subsequently, dressing is applied at the opening in the skin. The entire procedure usually takes 1 to 3 hours.